and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's medical news. Cell therapy appears safe and effective for lymphoma in remission. A study led by researchers at Sylvester Comprehensive Cancer Center at the University of Miami Miller School of Medicine suggests that CAR-T immunotherapy remains a viable option for patients who have lymphoma that goes into remission before the cell therapy begins. Most patients receiving cell therapy, a form of immunotherapy that uses immune cells engineered to recognize and attack the patient's cancer, desperately need it. For some, it comes after many other treatments have failed, but Wang noticed an odd phenomenon in the past few years when treating lymphoma patients with this form of therapy. Some of his patients went into complete remission before the cells were touched their bodies. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. This uncommon scenario occurs during the process of getting to cell therapy, which is in the case of Wang's study uses a kind of engineered immune cell known as CAR-T cells. When a patient starts a process, there is a waiting period of 3 to 5 weeks before they get the treatment. Insurance approval is needed and the cells themselves need to be manufactured from the patient's own cells. But many of these patients are very sick with their cancer, so physicians will often treat them with a short course of chemotherapy or other drugs to tamp down the symptoms. A small handful of these patients end up in remission during this waiting period treatment, the clinicians have found. They found that this group of patients had a 43% probability of progression-free survival over the 2 years following their treatment, about the same percentage as patients in the registry who were not in remission when they received CAR-T. However, the patients in remission had very low levels of toxicities related to their cell therapy, namely an immune overreaction known as cytokine release syndrome and neurotoxicity, two side effects that can sometimes accompany CAR-T cell therapy. Researchers said that prompted this dilemma. Now, what are we supposed to do? Should we change the plan or give the therapy anyway? We just did not have a lot of information on this scenario. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.